It is so normal to think that there is something everyone knows about a topic that you're interested in that you just don't know about. So today I'm going to give you 3 secret keys to labor and delivery that nobody talks about, but can really be the key to a great birth. Really quick, I took this video from a full post on my website. I'll put the link down below in case you want to read about it. Now, I will say the third one is something people talk about, but they don't talk about how scary it can be. So keep watching. Okay, the first one is that you can go home. It's funny, we talk a lot online about how you can refuse things at the hospital, but we don't talk a lot about online the fact that you can go home. Now, is it always safe to go home? Absolutely not, but you always actually have the choice to leave the hospital. Now, nurses can sometimes talk about how your insurance might not pay and you're leaving AMA and all these different kinds of things, and you definitely want to make sure that it is a safe option for you. But for a lot of patients, we will offer, you know what, it doesn't seem like you're in active labor, or it doesn't seem like this induction is really working out. Would you be interested in going home? And you would think that I had offered them to like stab their partner or something. No, I'm just saying maybe home would be a better spot for you for a little bit, and then we could try this again, or maybe you'll go into labor on your own. It's just something people don't really want, or they don't want to think about the idea of going home and they're still pregnant, because I know when you left your house, you thought, when I come home, I'm going to have a baby. But sometimes patience is the key. Absolutely not patient over here. I totally understand why you don't want to go home, but there are times that we end up doing more interventions when going home and maybe waiting a day or two or even a week might have been a better option. Now, I've got to say, when I would bring this up with patients, a lot of times I got a lot of kickback. And sometimes when I would bring it up to providers, they would think there is 0 chance this girl wants to go home. And so sometimes they wouldn't even bring it up. So if you're like, it doesn't seem like I'm really in labor, or it doesn't seem like this induction's going anywhere, ask, do you think I could go home? Do you think that's a better option for me? And you can have that conversation. Now, if you're at the hospital because you have super high blood pressure and there's a chance that you're going to seize, going home is not going to be your best option. But for a lot of people, it is an option. And I think it would save you from stress in the hospital. Side note, I've also seen a lot of people who come in for high blood pressure, say it was high in the doctor's office, and then as we watch you a little bit longer, we start your induction, we notice your blood pressure is absolutely fine. And if you slowly start to realize that what you thought was a problem maybe isn't a problem, again, maybe you could go home. But of course, this is a conversation you're gonna have with your provider, full stop. By the way, if you're looking for more keys to a great hospital birth, check out my insider tips to the delivery room. I think you're going to really find that helpful as well. It's totally free. Okay, here's another one that I do hear talked about online, but I just don't think they aren't looking at the full picture. And that is that you can ask for a new nurse. Now, the key that you need to understand here is that you are likely still going to spend some time with the current nurse, because there is not a pile of nurses at the nurses station just waiting to get a patient. Usually hospitals are staffed really tightly, and it isn't fair to break up a nurse-patient relationship that is working to change it to yours. And in the hospital, we have found that most mistakes happen when we switch nurses. So we really try to not switch nurses as much as we possibly can, although we are very used to juggling staffing. So how do you go about doing this when you know that you're still going to probably see that nurse that you currently have for another hour plus? I think one of the best things to do is to ask to see the charge nurse. I also want to say here that nurses are very aware that some patients just don't jive with some nurses. We 100% get that, because we are often the one on the end who is not jiving with the patient, but we don't have a say in the matter. We still have to keep that patient. That's like a requirement of being a nurse. You just have to deal with whatever patient you're assigned. But I understand that some personalities just don't mesh. Nurses understand that as well. The first thing I would do is ask your partner what they think of the nurse, because you know, for some people, especially when you're in transition, there is no Mary Poppins of nursing that would be your best bet. You may just be in so much pain, you know, no nurse is going to be better for you. So check in with your partner, see what they're thinking about the nurse. If they too are on board, like, yeah, I think we could be a better situation. Or especially, you know, if you're 9 centimeters, you're going to have this baby very quickly, they probably are not going to switch you. So that's another key that a lot of people don't talk about. But if you find that both of you are saying, yeah, this really isn't a good fit, I would have them pop out into the hallway and just ask someone to speak with the charge nurse. So they are the person that is in charge of assigning patients to nurses. And when she comes into the room, you're just going to say, hey, it's just not working out well with her. I just hope that there's a better fit for me of a nurse. Is there a way that we could switch sometime soon? Again, letting them know that you understand there is not a pile of nurses somewhere that they can easily just transplant into your room. And of course, more flies with honey here, right? You aren't going to just want to douse her in vinegar about how horrible her hospital is. Just be respectful and say that you would like to make a change. Now, if your nurse comes in and they've heard that you want to switch, there's a good chance they want to know why. And I would just be as respectful and as kind as you can. This might be a chance for them to improve. They might be able to be a better nurse by you giving them some input, or maybe it's just their personality and you guys weren't a good fit. And, there's only so many things that we can change. And then hopefully within the hour or so, you can switch to a different nurse. Now, pro tip, if you find that nurse, you're just not getting along that well, but when shift changes, you can always say, hey, when do you get off? When does staffing change? You can also speak to the charge nurse and tell them what you would like in an incoming nurse so that they can make a good fit for you on that next shift if you think you can wait. Okay, this final one is something that people talk about, but they don't talk about how scary it can be. And that is that it is best to labor at home as long as you can. Now, my husband absolutely did not like this. He wanted to go right into the hospital, even though he was married to the pregnancy nurse. And I would be like, no, we can hang out home a little bit longer. He didn't want to deliver the baby in the car, although, hello, I think I would have been the one delivering the baby in the car. But I'm just saying that it can feel really scary to do at home because you're planning on the hospital managing your birth. But we know that the best place for you in early labor, which is usually 4 to 6 centimeters, is at home, not at the hospital, unless you have some underlying conditions. However, once you get into active labor, which means that your cervix is actively dilating, like if we were to check you right now and then check you again in an hour, your cervix has changed in between those time periods. That shows that it is actively dilating, which means you are in active labor, which again, usually happens between 4 to 6 centimeters. And you might be thinking, Hilary, I cannot check my cervix. There are a lot of factors about when you should go into the hospital. If you have a question, I totally recommend calling your provider. For so many of you, you're pretty far out from your hospital. So I think it's important to talk with your provider. And I got to say that as a nurse, I could tell on the phone if you were ready to come in most often or not. So calling them can be a great thing. At your next prenatal appointment, ask your provider what you should be doing if you think you're headed into active labor so that you know what the procedure should be. Some of it's called labor and delivery, some it's the provider, some has just somebody on for them 24/7. So find out what's best for you. However, laboring at home can be a big key to getting the hospital birth that you want. Now, why is that? I call it the watched pot theory. The longer we watch you in the hospital, the more likely we are to provide you with an intervention. We might see that the baby's heart rate goes down at one point, which, by the way, if we watched any baby 24/7, their heart rate is going to have some issues. If we watched you or me 24/7, our heart rate's going to have some issues. That's just how things go. But in the hospital, because we're watching and so worried about liability, we might provide an intervention that you may or may not want. Plus, the hospital just sort of sucks. And yes, this is a nurse saying that. In fact, I think the hospital is so crappy. I let my appendix burst at home because I did not want to go into the hospital. So I totally understand this. Just FYI. Editor Hilary here to say that I said we might provide an intervention that you might not want. I'm not saying that gives us like the free for all to do whatever the heck you want. But sometimes we'll be like, oh my gosh, baby's heart rate's going down. And we'll be like, oh, we need to do XYZ. When in reality, maybe you didn't need that because we're all the eyeballs on you. I hope you guys understand what I mean. I'm not saying that we should do things without consent. I'm saying that you're going to consent to things because we're also worried just staring at you. Hopefully that makes sense. At home, you have your people, your things, your food, your smells, your favorite blanket, and your bed that you love to nestle in. It's just very different at the hospital. And when you're at home feeling so very comfortable, that allows that oxytocin to flow throughout your body and help labor progress. I am so glad that you're here. When you guys like videos like this, it tells YouTube that this is high quality pregnancy content and it shares it with more people. We really appreciate every single one of you that like our videos. Now, the keys to laboring at home usually come from a great partner who is ready and willing to assist you in a few different things. Now, I totally recommend that you come join me in the online prenatal class for couples. We have a whole chapter on this, but I'm going to give you 3 keys to get you started about early labor at home. Number 1, sleep. So often, everyone gets so wound up timing the contractions, thinking, is this labor? Is it not labor? And I'm here to tell you that if you can sleep, that is your absolute best bet. Your partner can probably keep an eye on contractions. If it's waking you up every time, he can just monitor it. And really, I think it's best to ignore those contractions, especially on your first baby, until they're getting closer than 5 minutes apart. So sleep if you can. Huge fan of it. Your body is going to thank you. Number 2, if you are not sleeping, aka resting your eyes, as my mom used to always love to say, although I'm pretty sure she was sleeping, you should be moving. Every 30 minutes, changing position. Now, if you just want to lay in your bed, it can be moving side to side. But if you have the energy to get up, maybe it's doing some lunges. Maybe it's doing some squatting. Maybe it's hanging out on that labor ball, doing your sexy hip circles. Just change position every 30 minutes because that is going to help your baby get their groove on into the best spot into your pelvis. Movement is a huge key to labor. I have some labor movement cards in the online prenatal class for couples that people find super helpful, especially partners, because they may be like, okay, it's time to move, but then they have no idea what would be a good choice to try. So those movement cards can be super handy. And the last one is to eat. A lot of people think for some reason like they shouldn't be eating. Now, if you're feeling 100% nauseous, then don't eat because you don't want to see the food again. But again, your partner can provide you with a snack that usually balances carbs and protein and just have it close by so that when you're ready to take a bite, you can have it because again, you got to fuel this body. You're going to be running a marathon soon. So the more you can sleep and eat and really get your body ready for it, the better off you're going to be. I love that you're getting these secrets for labor, but I gotta say, is your partner getting these? Are you gonna send him this video? I really think it's so awesome when people get prepared together. That's why I created a birth class that you could do in such a way. Now, these are 3 keys to labor, but I think there is a big key to a great pregnancy, which in fact decreases stillbirths by 33%. I'm gonna leave the video for that up above. Thanks for joining me here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.